I think it's important for Black women, and I would say women in general, to be in positions of leadership because our diverse opinions and our perspective helps to move the agenda. Women have a very unique experience. I am Sandra Scott, the Executive Director of the Brookdale campus of One Brooklyn Health, and I'm also an emergency physician. I'm the first female Executive Director of the hospital, I'm the first person of color, and I'm the first physician. When I first had the opportunity to apply for the position, I wasn't really thinking about that. I was thinking more about why I wanted to be the Executive Director of the hospital and what influence I might have to help improve the quality of healthcare for the community that we serve. That's the most important thing I was thinking about. And I'll tell you, it was through COVID. So during 2020, I was the chair of emergency medicine for One Brooklyn Health. And the chair just means like the clinical leader or the physician leader of all of emergency medicine for the system. And I don't think I have to tell the audience how traumatic that was. But you know, this particular area of Brooklyn was very hard hit by COVID. And it was a really struggle, both emotionally, professionally, personally, to get through that. And I think what I recognized more than I had ever recognized in my entire career is that policy makes a difference, legislation makes a difference, and having diversity at the table when decisions are made about, for example, where did the vaccines go, right? You know, where does the testing go? Those decisions were made around tables, the Department of Health, the state, you know, laboratory leadership. And so I really recognize that it's really important for diversity to be there so that we make decisions that protect all people. And I think that's what propelled me to think about the advantage I would have to lean in and to help to continue the trajectory of One Brooklyn Health in Brookdale to serve our community. So I studied medicine in Houston, Texas. I did my undergraduate work at Louisiana State University in Baton Rouge, Louisiana. So we're talking about the South in the 80s and 90s. We had to deal with being the only one, maybe the only woman, maybe the only person of color, numerous times. And you can imagine as I advanced through my career, I did emergency medicine in Boston at Boston Medical Center, and then came to New York City to practice emergency medicine. And as I grew in the field and took on more and more leadership positions, there were just, you know, it was very common for me to be the only woman and or the only person of a color around the table. And I would say that, you know, unfortunately, you know, when you're kind of, what they say, breaking the glass ceiling, you know, you get cut occasionally. But I've really always been really passionate about serving patients, regardless of their gender, race, etc. And it brings me joy. And so I think the joy that I get from the work that I do is what allows me to keep moving forward. I want to be a part of the change that I want to see in the world. And so unfortunately what comes with that is having to deal with racism and sexism, you know, etc. I think it's important for Black women, and I would say women in general, to be in positions of leadership because our diverse opinions and our perspective helps to move the agenda, right? Women have a very unique experience, right? We all know that. And so when women are able to sit at the table and help to shape the decisions and the policies, everyone does better, right? Women typically have a view around family, and they understand the importance of parenting. They understand the needs of children. So imagine if you have a woman at the table, you know, having all of that, bringing all of that knowledge base to the decisions that we make that impacts our communities is very important. And I would say rather, even if it's not in healthcare, right, in the IT industry, right, if you think about in the finance industry, diversity matters, and it really helps to improve the outcomes regardless of the industry. I can tell you it was shocking for me how much just having someone that the staff and the community can relate to makes a huge difference. So the physicians in the system in my hospital feel very comfortable talking to me about some of their challenges or even their ideas about growth and change for the future. I think being someone that a multitude of people, a diverse group of people can relate to, helps to make my job fun, and it makes it a lot easier. I think it allows me to have relations with my staff and the community that might have been a barrier had it been someone else in this position.